Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. More than 100 clerics and Reverend Sisters get first jab of Moderna vaccine in Cross River State's vaccination drive. Health personnel strategize to keep up as residents of Akwa Ibom State respond favorably to the call for vaccination. And Australia aims for 70% vaccination coverage by early November as 3/4 of people over 16 in New South Wales already partially vaccinated. Global cases for COVID-19 has crossed 222 million cases, with a death toll over 4.5 million. In Africa, total cases is almost 8 million registered across the continent, with a death toll now over 200,000. Most of the cases are registered in the south, followed by the north, countries in the east, while the western region is next. The lowest is recorded in the central part of the continent. Meanwhile, 17 deaths were recorded last night in Nigeria, with additional 597 fresh cases reported across 13 states of the Federation and the FCT. Here's more on the virus update.
597 additional persons in Nigeria have now tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 13 states and the FCT, indicating an increase from the figures reported earlier. Lagos recorded the highest tally of 204. 89 cases were recorded in Rivers, 65 cases were recorded in Edo. FCT had 50, Oyo had 47, while Enugu State reported 46 cases. Ekiti recorded 24 cases, Cross River 17, Delta and Gombe registered 15 cases each, Osun had 12, Plateau had 6, Benue had 5, while 2 cases were registered in Kano. There were 0 cases reported from Abia, Nasarawa, Ondo, and Sokoto states. Nigeria now has a total of 196,487 confirmed cases. 277 people have been discharged in the last 24 hours, increasing the total number of recoveries to 185,159. 17 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,573. Presently, there are more than 8,000 active cases in Nigeria, while over 2.8 million samples have been tested so far. Over 1 million eligible Nigerians have been vaccinated with the first dose of Moderna vaccine, while over 168,000 eligible Nigerians vaccinated with the first dose have received the second dose of the AstraZeneca vaccine. In Africa, there are more than 7.9 million confirmed cases and over 200,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 222 million, while more than 4.5 million deaths have been reported.
And over 100 clerics turned up to be vaccinated as the Cross River State government took its sensitization and vaccination exercise to Reverend Fathers and Sisters across its local government areas. This is in keeping with the plan of the state government to engage influential people and crowd pullers in the fight against severe disease and death due to the COVID-19.
Controversy has surrounded the distribution, administration, and even the conception of vaccines, resulting in questions and vaccine apathy. The Cross River State government is taking the bull by the horns by meeting with these Reverend Fathers and Sisters of the Ogoja Diocese of Catholic Church in Bekwara local government area. The religious leaders, over 100 of them, are educated about the virus and agree to take the jab.
this for us is a huge success because we've been able to send a message to the body of Christ that this vaccine is actually safe and this vaccine is what everyone needs to take to give us that herd immunity in Cross River, in Nigeria, that will reduce the spread of COVID-19.
The Director General of the Cross River State Primary Healthcare Development Agency is pleased that the health team is able to dispel myths that have been peddled about the vaccine.
That's why you see most of them are actually taking their first jab today. But I'm actually glad. It doesn't matter if they are not taken before, but at least now we're excited that they've all accepted to take the vaccine.
The Bishop of Ogoja Diocese speaks for other men of the cloth here when he appreciates being remembered for vaccination and included in the team of influencers against the COVID-19 virus.
We strongly appreciate the government for remembering us and coming directly to the church, knowing fully well that we have the capacity to reach out to more of the people.
According to experts, the state is racing against time to reach 80 to 90% vaccination of residents to ensure herd immunity and stop the disease in its tracks. It's expected that the help of these clerics will increase acceptability and uptake of the vaccine among their congregation since they are now participants.
And there's been a large turnout of residents at Uyo, the Akwa Ibom state capital, designated centers to take their jab of the COVID-19 vaccines. Channels Television visited the primary health center located along Wellington-Bassey Way in Uyo, the state capital, to ascertain the level of public participation in the vaccination rollout.
This primary health center, Uyo, has witnessed a large influx of residents of the city to take advantage of the free vaccination by the state government against the COVID-19 pandemic.
We've been having problem of having crowd control because of the upsurge of the people coming in for this vaccination. But we have devised a method whereby as an individual comes in, we do first come, first serve.
Some of those who've had their jab speak of their experiences and encourage those who are yet to receive theirs to do so, describing negative stories about the vaccines as misleading.
They should come and take their vaccine. It's free. They should not fear to save their lives.
This is my second jab. I just came this morning. I called yesterday. They asked me to come this morning for it, which I just came now and I've gotten it.
Akwa Ibom state government recently took delivery of over 63,000 doses of Moderna vaccine. There's also been a second delivery of vaccines after the first installment of 69,030 doses of Oxford AstraZeneca on March 10, 2021. The encouraging turnout may not be unconnected with the surge of cases following the discovery of the Delta variant of the virus.
Well, your vaccination record, sometimes called your immunization record, provides a history of all the vaccines you received as a child and adult. Well, this record may be required for certain jobs, travel abroad, or school registration. And now, with the advent of COVID-19, it may be more important than ever to have it. Well, joining us for more on this, especially as the vaccination rollout takes hold across Nigeria, is Nsa Basia Kanem. He is a pharmacist and public health practitioner. He joins us virtually. Thank you for joining us on the program. We know you held up a little bit somewhere in Lagos, but glad to have you join us. Tell us, does Nigeria have a central base for immunizations, like a database?
Well, the National Primary Healthcare Development Agency has a database that takes record of immunizations that are done in Nigeria. Unfortunately, the current immunizations that we have right now is not being captured by, it doesn't reflect other immunizations that have been carried out in the past for each individual. And I think that's what needs to be done right now, such that at the point of receiving immunizations, individuals, healthcare workers can have a good idea of all the vaccines that a particular person has taken before, since we do not have a national database that shows these immunizations in the past.
So in terms of administration of vaccines and COVID-19 as is ongoing, tell us, is there a sort of software platform for such?
Well, yes, there is a platform currently. In fact, that platform has been launched for both vaccines. And currently the platform for Moderna vaccine is available. And this platform basically is to document and serve as a reservoir for information on people who have taken the Moderna vaccine. And this is supposed to be like an information database such that in the future, persons can be identified, persons who have taken the Moderna vaccines can be easily identified. But what we desire is that the database or this software should not only contain Moderna vaccinations, but should also contain the database for all other vaccines that a particular individual has taken in the past. Let's say, for example, somebody who has taken yellow fever vaccine in the past, or maybe hepatitis vaccine. This vaccine history should be captured in the software so that, healthcare workers can have an idea of the vaccine that have been taken by each individual. And that can also be used in the national, database for immunizations in Nigeria. So that the software exists, but we are looking for a way we can make the software more robust and contain more information about people taking the Moderna vaccine.
So essentially, better surveillance system and database as part of the vaccination program. But what's your take on the registration process that's ongoing, and this is before vaccinating? Some people have complained of not accessing the portal or being shut out, and this is online when they've put in their preferred centers. And we've also heard some who say that there are new centers since Moderna came in, and they've been a little bit unorganized. Instead of starting, they said they'll start at 9 a.m., and you have them starting inoculation at about 1 p.m.
Yes, you are absolutely right. I've also received some reports too, and unfortunately, this it doesn't speak well of our organization of this vaccine rollout. And so I think it's a call out to the relevant agencies and the healthcare workers directly in charge of immunization planning and implementation to strengthen the system so that we can deliver these immunization services in a more efficient way. Healthcare workers must report on time, and of course, they should ensure that it is on a first-come, first-served basis that people are served. So we shouldn't see cases of racketeering, so that people who are willing to come out can be served adequately, because we know that there is already vaccine hesitancy. So the last thing we need right now is for people to come in and experience delays and all of that. So we are calling on all the people involved, agencies and healthcare workers, so please put in their best to ensure that Nigerians receive immunization, COVID-19 vaccination in a very conducive environment and with all amount of, effectiveness.
All right, we appreciate your time. Thank you so much for joining us. And Sebase Kanem, pharmacist, public health practitioner. We wish you safety, of course, in your onward journey. Thanks again.
Thank you for having me.
Still ahead on the program, we'll take you to Sokoto State as they have taken delivery of Moderna vaccines as well. Stay with us. Welcome back. Sokoto State has taken delivery of 34,440 doses of Moderna vaccines for the second phase of vaccination in the state. According to the State Commissioner of Health, Mohammed Ali Name, a total of 17,220 individuals have received the first and second dose as at the time of this report. The state has recorded over 700 COVID-19 cases and registered 28 deaths, and only 2 cases are currently on admission.
I'd like to use this opportunity to inform the general public that in Sokoto State we have received 34,440 doses of Moderna vaccine in the state. And this will be used for the second phase of the vaccination against COVID-19. And also want to use this opportunity to call on all people of the state and general public that we have available vaccine now. They can come forward and get their jab. This Moderna vaccine is also 2 jabs, so you'll receive the first dose, then after 6 weeks or more, you will receive the second dose or the second jab. So this is to say that we are going to have at least a minimum of 17,220 individuals that will receive the first and second doses of the jab.
Away from Nigeria, rising COVID-19 cases hasn't stopped the return to normal in the United Kingdom, and Britain's vaccination drive continues to edge onward with 26,624 first doses dished out and 85,848 second jabs given just yesterday. This means 48.3 million, 88.9% Britons have now had a first dose of the vaccine, while 43.6 million, that's 80.3%, are fully protected. Joining us to talk more about this, Dr. Moni Gasper, general practitioner at London in the UK, and she joins me now virtually. Thanks, Dr. Gasper, for joining us on the program. Most restrictions have been eased in England, Scotland, and Wales. Are there any other guidance in place where you are, and what else has changed?
Good evening, and thank you very much for having me again. The government has, right from the beginning of this pandemic, put the lives and livelihood of all its citizens as the #1 priority. Even with easing of the restrictions, which has just come into place, that still remains our priority focus. The vaccines have done a wonderful job of breaking the link between infections and severe disease and death, which was the end point of the vaccines. So now we're just learning how to come into our new normal of learning to live with the virus as much as possible, as well as taking necessary precautions. The lockdown that we might recall wasn't the be-all and end-all. We knew that it was a stopgap measure. We knew that it was just to buy time to get as many people, like you've mentioned, vaccinated as much as possible. Now we have over 80% of people double jabbed with all the available vaccines. We think it's time that we can now very cautiously start to go back to normal as much as possible. Is this the end of the pandemic? Absolutely not. We're still very much in the pandemic, and we still now have to take a lot of personal responsibility and be very aware of the risks to getting infections, even though we've all been, or majority of us have been vaccinated.
We also know that some people may worry that, things are, you've said cautiously back to normal, but not far from normal, actually. Do you think there's still anxiety over some of these measures that we have to live with and the rate at which the pandemic is going?
Absolutely. It's not 100%. We can't win all. There will still be infections. There have been about approximately 40,000 infections today and approximately 120 deaths, which are 120 too many for the loved ones who've lost people. But we have to live with the virus as much as possible. We obviously keep pushing for more vaccination. Unfortunately, the vaccination rate has dropped slightly, and the United Kingdom has dropped from the first 10, from being in the first 10. But nevertheless, the rate is rising, but at a much slower pace than it would have done had it been we weren't vaccinated. vaccinated. We're number 2 in Europe for how many people have been vaccinated, only secondary to Malta. So that is our defense at the moment. And our over 16s, over 80% have been vaccinated. So we have to still be cautious, yes, but we have to go back to normal as much as possible to protect our lives and our livelihoods. It's a balancing act, and we think at this time is the right time that we can try to start easing all restrictions and getting back to normal as much as possible, while everyone is taking proportionate care to what they need to do to protect themselves and to protect their loved ones.
Some have argued perhaps too fast, too soon, because when you look at the coronavirus infection survey, positivity rates were highest among teenagers and young adults. We're told school year 12 to those aged 24 years, and the lowest in adults aged 70 years and over. This is in the last week, late August. What do you make of the statistics, especially for children?
We expected this to happen. Thankfully, children tend to not have a severe disease, and children at the moment aren't being vaccinated. It's only being offered to 16 and 18 and over. But we did expect this to happen, and we still advise all the necessary sensible precautions that need to be done. There's no legal restrictions in terms of face coverings or social distancing, but these behaviors have been with us from the onset of the pandemic. So we're hoping that everyone will be sensible about what they need to do to protect themselves. We can't win all, but we will try. We can't stay on lockdown permanently. So we will try as much as possible. The government has taken measures as well to make sure they're ring fencing the defense that they've made already and all the progress we've made. And they have measures in place such that if it's necessary, there's contingency plans that will be activated if it's necessary to do so. So yes, the rates are going up, but not half as much as we would have expected if we hadn't had such a good vaccine program. So we just hope for the best.
Indeed. Thank you so much, Dr. Omoni Gasper, as a general practitioner, joining us from London, the UK. Thanks again for joining us on the program.
Thank you very much. Thank you.
Well, let's take a look. The Australian state of New South Wales reports a jump in COVID-19 cases as vaccinations ramp up, plus Austria to tighten COVID-19 measures for the unvaccinated. Here's more on the global update.
3/4 of people over the age of 16 in Australia's New South Wales have now had at least their first vaccination dose. The announcement comes as the state also reported its first rise in new infections in 3 days.
I'm incredibly proud of where we're up to, and there's more work to be done, but I'm confident the track we've been on, as difficult as it's been, is starting to bear fruit. Things are starting to change in terms of the trends that we're seeing, and we obviously want to see those trends concerned. So even though we're seeing case numbers very volatile, and as the modelling showed, we're expecting the peak sometime next week, please know that at any stage, if we do something that changes that modelling, if we do something drastic that changes that modelling too soon.
Australia has locked down Sydney and Melbourne, its largest cities, after outbreaks from the highly infectious Delta variant in June. The country now aims to live with rather than eliminate the virus once it achieves its broad vaccine coverage of about 70% of its adult population of 20.6 million, a goal it's expected to reach by early November based on current rates. Speaking of vaccinations, Bangkok has unveiled a mobile vaccination bus aimed at serving seniors, people with disabilities and other chronically ill people in the Thai capital as the country ramps up its inoculation drive amidst a surge in coronavirus infections. Authorities say the aim is to reach people with mobility issues who may have difficulty traveling from their homes. 16.5% of the Thai population has been fully vaccinated, while 38.75% have had their first doses. In Germany, officials say the country could see a massive momentum in new COVID cases in autumn if the vaccination rate does not increase. According to official data, the number of COVID-19 patients requiring hospitalization is increasing, and intensive care bed occupancy by COVID patients has already doubled in the last 2 weeks. And finally, Austria will tighten a range of COVID measures from next Wednesday onwards. However, these will primarily apply only to those who've not been vaccinated. The announcement came amidst rising infection rates and hospitalizations, including in ICUs. Chancellor Sebastian Kurz says the measures, which includes compulsory face masks, would apply to the unvaccinated only in order to protect them and to protect hospitals from becoming overloaded.
Remember to maintain a high index of suspicion and adhere to the preventive measures. You can take a look at our website. It has more updates, a better understanding of the pandemic, plus breaking news. It's at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.